Dear students, I am Dr. Dharmendra Sharma, Professor, Principal, Dean of the D.Y. Patil Homeopathic Medical College and also the Head of Department of Forensic Medicine. In continuing with Module 1, our third lecture is about consent in medical practice. In this lecture, we are going to discuss a fundamental concept in medical ethics and practice. We will cover in this lecture the definition and importance of consent, the different types of consent, the process obtaining informed consent, legal and ethical considerations, the recent developments and the special considerations for the vulnerable populations. Understanding consent in medical practice is crucial for both legal and ethical reasons, and as we know, our subject is also called as medical jurisprudence. So, medicine is pertaining to medical side, juris is the law and prudentia is the knowledge of. So, medical jurisprudence is the knowledge of medicine and law both. So, there is a legal importance, and in the legal importance we will be studying today the protection against liability. Properly obtaining and documenting consent shields the healthcare providers from legal claims such as malpractice, battery or negligence. Without a valid consent, any medical procedure can be considered as unlawful, leading to potential lawsuits or cases being filed against doctors. Compliance with the laws. Consent is a legal requirement under various national and international regulations. Healthcare providers must adhere to these laws to avoid penalties, professional sanctions or legal actions. Ethical importance. There should be a respect for autonomy. Ethically obtaining consent is a way of respecting a patient's right to make the decisions about their own body and about their own treatment. It acknowledges the patient's liability to make informed choices based on their values and their beliefs. Building trust. The consent process fosters a transparent and a trusting relationship between the patients and the healthcare providers. By ensuring that patients are fully informed, the providers demonstrate respect and care, which is essential for effective treatment and patient satisfaction. Upholding the ethical standards. The consent aligns with the core ethical principles such as beneficence, non-maleficence and justice, which means doing good, avoiding harm and being fair. It ensures that medical interventions are conducted with the patient's best interests in mind. In summary, understanding and properly implementing the consent in medical practice are vital for protecting both the patient's rights and the healthcare provider's legal standing, while also upholding the ethical integrity of the medical profession. So, consent in medical practice is a critical component of the patient caregiver relationship, embodying the principles of respect for autonomy and human dignity. It involves obtaining a patient's voluntary agreement to proceed with a medical intervention after they have been fully informed about the procedure, including its purpose, potential risks, benefits and possible alternatives. This process ensures that the patients are not subjected to medical treatments without their explicit approval, thereby protecting their bodily integrity and personal autonomy. How do we define consent in medical practice? It is a voluntary agreement of the patient to undergo a particular medical intervention after being fully informed about its nature, potential risks, benefits and alternatives. Consent is not just a signature on a form, it is a process of communication between the healthcare provider and the patient. Now, there are different types of consent. The first one is express consent. This is when a patient explicitly agrees to a procedure either in verbal or in writing. Next is the implied consent. In some situations, the consent is implied by the patient's actions, such as when they roll up their sleeve for a blood test, it means that the patient is ready for you to conduct the blood test. In such cases, it is considered as an implied consent. Then there is informed consent. This is a more detailed process where the patient is given all the necessary information to make an informed consent. Expressed consent refers to a clear explicit agreement given by the patient to proceed with a medical intervention. This consent can be provided verbally in writing and agrees to it voluntarily. The express consent is typically required for a more significant medical treatments or procedures where the potential risks and the benefits need to be clearly communicated to the patient and they must understand it. Example, imagine a situation whereas a person in India visits a dentist for a tooth extraction. Before the procedure, the dentist explains the process, the risks involved such as pain, bleeding, infection, etc., and any alternative treatments. The patient listens to the explanation, asks any questions they may have, and then verbally agrees to the tooth extraction. The patient may also sign a consent form provided by the dentist. This verbal agreement or signed form is an example of expressed consent. In this scenario, the patient's clear and informed agreement to the procedure is considered as the expressed consent, as they have explicitly acknowledged and accepted the treatment plan which the doctor has just told them about. So, this is what they have agreed upon in advance. Then coming to implied consent, it refers to a situation where a patient's agreement to a medical procedure is not explicitly stated, but is inferred from their actions, behavior or the circumstances. This type of consent is often assumed in routine and non-invasive procedures or in emergencies where explicit consent cannot be obtained. Consider a scenario, example 1, Dr. Ajay's clinic in India. A patient, Mr. Karan, visits Dr. Ajay for a routine health checkup. During the consultation, the doctor suggests on checking Mr. Karan's blood pressure. Mr. Karan rolls up his sleeve and extends his arm towards the blood pressure cuff without verbally saying anything. By this action, Mr. Karan is indicating his willingness to have his blood pressure checked, even though he did not verbally say yes. So, it was implied by his actions that he had, because he rolled up his sleeve, that he is ready for a blood pressure test. In this case, Mr. Sharma's action of rolling up his sleeve and presenting his arm is an example of the implied consent. Dr. Ajay interprets this action and the patient's agreement to proceed with the blood pressure measurement. Informed consent is a cornerstone of medical practice. It is the process through which a patient voluntarily agrees to undergo a specific medical treatment or receiving any comprehensive information about the proposed intervention. It includes about the nature and procedure and the potential risks and benefits which have been told to the patient. So, the possible alternatives also and the consequences of refusing treatment. In case he does not want to consent, the doctor needs to tell him that if you do not agree upon this, these consequences could occur. Informed consent requires that the patient's autonomy is respected and that they are the active participant in the decisions which are going to take about his health. Key elements of informed consent is disclosure, comprehension, voluntariness, capacity and documentation. Regarding disclosure, the healthcare provider must disclose all the relevant information about the procedure or the treatment. This includes the purpose and the nature of the proposed intervention, the potential risks and the side effects, the benefits and the expected outcomes. Any reasonable alternatives, including opting for no treatment. The information should be presented in a way that it is understandable to the patient, considering the language, education level and the cognitive abilities. It is just not enough for the doctor to just go about getting the informed consent without considering all these points. Coming to the next point is comprehension. It is crucial that the patient fully understands the information which is provided. This may require the healthcare provider to use layman terms instead of medical jargon, provide written materials or visual aids, engage in a dialogue where the patient can ask questions and express concerns. The healthcare provider should assess the patient's understanding by asking them to summarize what they have learnt or by clarifying any misconceptions. So, the patient can repeat what the doctor has told, so that the doctor knows that the patient has actually understood this. Then voluntariness. The decision to the consent must be made freely by the patient without any coercion, that means without being forced upon. The patient should feel that they have the power to make the final decision. The healthcare provider should create an environment where the patient feels comfortable about discussing their options and expressing their own preferences. Then next is the capacity. The patient must have the mental capacity to make an informed consent. This means that they should be able to understand the information provided, appreciate the consequences of their decision and the reason about the options which are available. If a patient lacks the capacity due to his age, due to his cognitive impairment or due to other factors, a legally authorized representative such as a family member or a legal guardian may provide the consent on their behalf. Then documentation. The consent process should be thoroughly documented in the patient's medical records. This typically includes a signed consent form which is available at most of the doctors, which serves as a legal evidence that the patient was informed and has agreed to this procedure. Documentation may also include notes from the discussion, highlighting any specific questions or concerns raised by the patient. Now, an example of informed consent in practice with example Dr. Ajay. So, consider a case scenario that a patient Mrs. Mehta visits her doctor Dr. Ajay, a cardiologist, after experiencing recurrent chest pains. Dr. Ajay recommends that Mrs. Mehta should undergo an angioplasty, a procedure to widen the blocked narrowed coronary arteries. So, a step by step informed consent process. In disclosure, Dr. Ajay explains the angioplasty procedure in details to Mrs. Mehta. He described how a small balloon will be inserted into the artery and inflated to open the blockage, and how a stent may be placed to keep the artery permanently open. He discusses the potential risks such as bleeding, infection or a rare chance of heart attack during the procedure. He also outlines the benefits, including reduced chest pain and a lower risk of future heart attacks. Dr. Ajay presents alternative treatments such as medical management or coronary artery bypass surgery, and also explains the risks of not undergoing any treatment, which might include worsening heart conditions or even a heart attack. Further, Dr. Ajay asks Mrs. Mehta if she understands the procedure and encourages her to ask any questions. Mrs. Mehta is concerned about the risks and asks for some clarification. Dr. Ajay patiently answers all her questions using simple language and analogies to ensure that she grasps the basic concepts. He also provides a brochure with diagrams that illustrate the procedure. To confirm her understanding, Dr. Ajay asks Mrs. Mehta to explain back and that what she has understood about the angioplasty and why she is considering to go in for an angioplasty. Then coming to the next point of voluntariness, Dr. Ajay reassures Mrs. Mehta that the decision to proceed with the angioplasty is entirely up to her. He explains that she can take some time to think it over, consent with her family, or even seek a second opinion if she wishes for. Mrs. Mehta appreciates this approach and feels no pressure to rush into a decision. After discussing it with her family, she decides to proceed with the angioplasty. So, regarding capacity, Dr. Ajay assesses that Mrs. Mehta has the capacity to make the decision herself. She is alert, understands the information which is provided, and is able to articulate her thoughts clearly. There are no signs of cognitive impairment or any confusion in her mind. Since Mrs. Mehta is fully capable, she signs the consent form herself. However, if she had shown signs of cognitive impairment, Dr. Ajay would have to need to involve a legal guardian or a family member to provide the consent. Regarding documentation, Dr. Ajay documents the entire consent process in Mrs. Mehta's medical record. He notes the details of their conversation and including the risks and the benefits as discussed, the questions she asked and her decision to proceed. Mrs. Mehta signs a written consent form which Dr. Ajay also asks her to sign and confirming that he has provided all the necessary information and answers all her questions. Coming to a case study regarding informed consent for surgery. Now, the scenario is such that Mr. Kumar, a 45-year-old man from Mumbai, is diagnosed with gallstones and requires surgery. The name of the surgery is cholecystectomy to remove the gallbladder. Dr. Shreya is the attending surgeon. These all names are random names. So, Dr. Shreya, the attending surgeon, needs to attain or to get the informed consent from Mr. Kumar before proceeding for the surgery. Now, coming to the key features of this case, number one point we have to discuss is disclosure. So, Dr. Shreya explains the surgical procedure to Mr. Kumar, including the steps involved, the risks of such surgery which includes infection or bleeding, then the potential complications that can occur after this surgery, and the benefits which could be relief from the pain and prevention of the further complications. She also discusses the alternative treatments like medication management and non-surgical operations which the patient can decide for herself. Next is comprehension. Dr. Shreya ensures that Mr. Kumar has understood all the information by asking him to repeat all the details which he had just told about. She uses simple language and visual aids to explain the process to Dr. Kumar. Then another case about informed consent for blood transfusion. Coming to the third point, voluntariness. Mrs. Patel is assured that decision to accept or to decline the transfusion is only hers and she is not pressurized in any way. She is encouraged to take her time and consult with her family. Mrs. Patel, though physically weak, is mentally sound and fully understands the situation. She can make an informed consent decision regarding this blood transfusions. That explains the capacity. Then regarding the documentation, after discussing with her family, Mr. Patel agrees to the transfusion. So, she signs a consent form and Dr. Rajesh documents the entire conversation. The solution, Dr. Rajesh effectively obtains the informed consent by thoroughly explaining the procedure, ensuring the understanding and respecting Mrs. Patel's autonomy. The transfusion is carried out successfully and Mrs. Patel's condition improves. Coming to another scenario, case 3, informed consent for pediatric vaccination. Now, a 2-year-old child Rohan is brought to a pediatric clinic in Delhi for routine immunization. Dr. Mehta, the pediatrician, needs to obtain the consent of Rohan's parents before administering these vaccines. Dr. Mehta explains the purpose of the vaccines, the diseases they prevent, the potential side effects like fever, swelling at injection site, etc., and the benefits of immunization. She also discusses the vaccination schedule and the importance of timely vaccinations. The doctor also asks Rohan's parents to express any concerns they have or any questions if they he needs to answer for them. She uses simple language and a vaccination chart to explain the process to her patient. The parents ask about the side effects and Dr. Mehta provides reassurance and additional information as needed by the patients. Dr. Mehta emphasizes that the decision to vaccinate Rohan is up to the parents. She gives them time to discuss and decide without any pressure, demonstrating the voluntariness. Rohan's parents are capable, well-informed adults who understand the significance of vaccinations. They are able to make the decisions on behalf of their child. Thus, the capacity to go in for the vaccination is there. Then Dr. Rohan's parents provide their consent verbally and sign the vaccination record. Mr. Mehta documents the discussion and the patient's consent in Rohan's medical file. That means that the documentation is now in place. The solution then further Dr. Mehta follows all the key features of informed consent, ensuring that Rohan's parents make an informed consent and a voluntary decision. Rohan receives his vaccinations on schedule with no adverse effects. Coming to the next case study, it is informed consent for mental health treatment. The scenario is Mr. Singh is a 30-year-old man from Bangalore. He is diagnosed with severe depression and anxiety. Dr. Priya, who is a psychiatrist, recommends starting medication or antidepressant pills along with cognitive behavioral therapy, which is also called as CBT. The key features: in disclosure, Dr. Priya explains the treatment options which are available, including the benefits of medication and therapy, the potential side effects of all the antidepressants such as weight gain, drowsiness, etc., and the expected outcomes of this therapy. She also discusses the alternative treatments like lifestyle changes or other forms of therapy which are available. Dr. Priya ensures that Mr. Singh understands the treatment plan by having a detailed conversation about each option. She encourages him to ask questions and discusses any fears or misconceptions he may have. So, she tries to find out whether they have really comprehended all the information which has given to them. Coming to the next study, informed consent for mental health treatment. Dr. Priya reassures Mr. Singh that the decision to proceed with the treatment is entirely his, and she gives him time to think it over and discuss it with his family if needed. Despite his medical treatments and health challenges, Mr. Singh is fully capable of understanding the treatment options which are available and making informed decisions. Dr. Priya assesses his capacity and finds him to be fit for giving this consent. So, Mr. Singh agrees to start the medication and therapy. He signs the consent form for the treatment, and Dr. Priya documents their discussion and his medical records. So, thereby documentation is in place. The solution: Dr. Priya ensures that Mr. Singh is fully informed about this treatment decision, and respecting his autonomy and capacity, Mr. Singh begins his treatment, which leads to significant improvement in his condition over time. The next case study is about the informed consent for an emergency procedure. Now, here we will see something different. Mrs. Desai, a 55-year-old woman from Chennai, arrives at an emergency department with a ruptured appendix. Now, Dr. Arvind is the emergency surgeon. He recommends an immediate appendectomy to prevent any life-threatening complications. So, despite the urgency, Dr. Arvind quickly explains the necessity of the surgery, the risks which are involved like infection and complications which can arise from anesthesia, and the expected benefits, that is removal of the inflamed appendix to save the life of the patient by preventing any sepsis. He also briefly mentions that delaying the surgery could lead to severe complications or to death. Dr. Arvind ensures that Mrs. Desai understands the situation by asking her if she has any questions. Giving the emergency nature, he uses straightforward language and reassures that the procedure is required and essential, and also that it is urgent. Then informed consent for an emergency procedure. To continue this, Dr. Arvind has obtained the informed consent in emergency condition, balancing the need for a quick action with the patient's right to be informed. The surgery is successful and Mrs. Desai recovers without any complications. Although the situation is critical, Dr. Arvind had already emphasized that Mrs. Desai has the right to decide. However, he strongly advises, he has advised already that the immediate surgery is the best course of action to save her life, and that she is in pain, but is fully conscious and to make the decision. She understands the gravity of the situation and the consents of the surgery. Also, all the documentation was in place because Mrs. Desai provided her consent verbally, because it was a due emergency and Dr. Arvind had proceeded with the surgery without signing any documentation. The next important point is obtaining the informed consent in the medical field. Obtaining the informed consent in the medical field is a crucial ethical and legal requirement that ensures the patients are fully aware of and have agreed to the medical procedure or the treatments which they need to undergo. The process of obtaining the informed consent involves several steps designed to protect the patient's autonomy, to promote transparency and enhance the doctor-patient relationship. Here is a detailed online account, an outline of this process. Number 1, preparation for the consent process. Before beginning the consent process, the healthcare provider or the doctor should prepare by understanding the procedure. So, the physician and the healthcare provider should have comprehensive understanding of the proposed procedure. He should also explain this to the patient, the treatment or intervention, including its risks, benefits and alternatives and its potential outcomes. The patient assessment needs to be done, where the doctor should assess the patient's ability to understand the information that will be presented. This involves evaluating the patient's cognitive abilities, whether the patient is actually able to understand what the doctor will say, his language proficiency and his emotional state. The healthcare provider must also thoroughly disclose some information, key information to the patient, that is about the nature of the procedure or the treatment. A clear explanation of the procedure of the treatment, included what it entails and why it is recommended. The patient should be tailored to the patient's level of understanding, avoiding overly technical language. The benefits, a detailed discussion of the potential benefits of the procedure or treatment, including how it may improve the patient's quality of life and the prognosis of this disease. Regarding risks and complications, a candid discussion on the potential risks, its side effects and the complications associated with the procedural treatment. This includes both common risks and serious complications. Then the alternatives need to be told to the patient, that an explanation of all the reasonable, whatever alternative is available to the proposed procedure or the treatment, including the option for undergoing the procedure at all All these benefits and risks and these alternatives should also be discussed with the patient. Prognosis without treatment, information about what may happen if the patient chooses not to undergo the procedure and treatment should also be told to the patient. This includes the natural progression of the disease and any potential risks of inaction, how long this disease is going to go, what could happen if he does not take treatment, everything needs to be told to the patient clearly. Although the decision to go in for the procedure, it depends straight upon the patient. Then coming to ensuring the patient comprehension, after disclosing the necessary information, the healthcare provider must ensure that the patient understands what has been told to him. There should be an interactive discussion where the patient is engaged in some part of the discussion, encouraging them to ask questions and express any concerns. This helps us to gauge their understanding and allows the provider to clarify any confusing thoughts. The use of visual aids can be done for this, diagrams, models, pamphlets to explain complex procedures and treatments. Visual aids can be make it easier for the patient to grasp all the intricate details which the patient must know before giving his consent for any procedure. Teach back method is also very important. The provider can ask the patient to repeat all the information which has already been told to the patient in their own words to ensure that now they really understand the procedure. This teach back method helps us to confirm that the patient has clearly understood the risks, benefits and the alternatives. Then to assessing the voluntariness, the consent procedure must ensure that the patient's decision is voluntary and free from coercion. There is no pressure on the patient, he should feel free to make his own decision without pressure of the doctors, family members or others. The provider should explicitly state that the choice is entirely the patient's and that they can take their own time to decide. The time for decision making, provide the patient with adequate time to consider the information, discuss it with their family members or trusted individuals. In non-emergency situations, patients should not be rushed into making any decision. Now, we also need to evaluate the patient capacity. So, before obtaining the consent, it is important to assess the patient's capacity to make informed decisions, whether he has the mental competence for that. Patient needs to be mental competent to understand the information and make any informed decision. If the patient is unconscious, mentally impaired, he is a minor, the consent must be obtained from a legal guardian or a surrogate decision maker. Then coming to the legal considerations, the provider must follow the legal guidelines to determine who can provide the consent if the patient lacks the capacity. This might involve seeking consent from a power of attorney, a family member or a court appointed guardian. This is need to be done to prevent any legal complications in future. After the patient has made an informed and voluntary decision, the healthcare provider must document all the consent procedures. So, a consent form can be kept and a record of discussion. So, in the consent form, the patient or their legal representative signs a written consent form which outlines the whole procedure, the risks, the benefits, the alternatives as discussed, and the form should also indicate that the patient had the opportunity to ask the questions and voluntarily agreed to proceed. A record of discussion also should be kept. The provider should document the entire process of consent in the patient's medical record. It should be mentioned along with the case paper, it goes in. This includes the details of the discussion, any questions the patient asked and their responses. Provide patient with a copy of the same. The patient should receive a copy of the signed consent form in their records and the patient is given a copy of the consent form, ensuring that they have a reference of the information which was discussed. This also serves as a record of their consent. So, it is safe for the doctor to do that. Then the healthcare provider's copy, the original consent form is kept in the patient's medical file as a part of their permanent record. So, tomorrow if there is some legal issues arising, you already have the consent, documented consent available with you. Revisiting consent is needed. In certain situations, it may be necessary to revisit the consent which process. Changes in the condition can cause that. If the patient's condition has significantly changed or if new risks have emerged, the consent process should be revisited. The provider should update the patient about the new circumstances and if necessary make a new consent, considering the conditions which are prevailing at this time. Then ongoing consent procedure is needed for medical treatments. For ongoing or multiple treatments, consent may be needed to be reobtained periodically, especially if the patient's understanding or circumstances keep changing over the time. So, doctor needs to keep taking consent if he feels that the patient's consent requirement is changing. A special consideration, the consent process may vary depending upon the specific situation or a patient group. In emergency situations where immediate treatment is necessary to save the life of the patient or prevent serious harm, informed consent may be implied. So, informed consent could become implied consent. However, if possible, a family member or a legal representative should be consulted before that. Cultural sensitivity. Then providers should be aware of all the cultural differences that may affect the consent process. They should respect the cultural practices and if necessary involve a translator or a cultural mediator to ensure clear communication between the doctor and the patient. For children and adolescents, minors' consent may be typically obtained from the parent or the guardian. However, older children and adolescents should also be involved in the discussion to the extent that they can understand and contribute towards the decision making process. Coming to the end of this topic, we will conclude whereby obtaining the informed consent is an essential part of the ethical medical practice. It respects the patient autonomy and ensures transparency. It builds trust between the patients and the healthcare providers. By following a thorough and a patient-centered consent process, the healthcare providers can ensure that patients are fully informed, comfortable with their decisions and are engaged in their care. Thank you.